Again, if anybody finds a pair of gold rim glasses, please let us know. Oh, good morning, ladies and gentlemen. Welcome back. This is the 43rd Annual Cancer Control Society Convention, Labor Day weekend 2015, Sheraton Universal Hotel, lovely Universal City, California. Our next speaker has been here a number of times. He's also a recipient of a humanitarian award issued by the Cancer Control Society, and has been in this field for a long time. He's one of the real pioneers and real humanitarians, and somebody that I've considered a friend for at least 20 years. But Dr. Michael Schachter, not only in his clinical work, but he's supported the Cancer Control Society in many ways, and he's always put himself out in front for the best interests of his patient. Dr. Schachter, thank you so much for being here.
Can we fix that to 45? In 45 minutes. Thank you all. It's a pleasure to be here, and I applaud the work of Frank and Lorraine all this time. I actually got into this field about a year or two after the Cancer Control Society was formed, which I think was 1972, and I've been doing practice. We just celebrated our 40th anniversary for doing this kind of medicine at the Schachter Center. So this is some contact information. It's up on the screen. It's also in the biographies, and if you get our website, there's a lot of information on that. And on the first table, as you walk in on the back, there's some handouts and some other contact information. And if they run out, you just have to, and you're interested in it, just contact our office and we'll email it to you. Okay, so this is just a disclaimer saying I'm not making any claims. This is lectures for educational purposes only. Now, my interest in Sip1 B1 and Salvestrols goes back about 7 years when I learned about it at an orthomolecular medicine meeting in Canada. And I was very interested in it. It showed a lot of promise. But at the same time, at that time, and probably since about 1975, I have been I had been seeing patients with cancer and a lot of them were using amygdalin and Laetrile, which you hear a lot about at this conference. And I was a little discouraged because I found out that you cannot use Salvestrols and Laetrile at the same time. You either use one or the other because the Laetrile or amygdalin or B17 will interfere with the enzyme that's necessary for the Salvestrols to work. So you'll learn more about that in a while. But in 2012, I received Brian Schafer's book, and I read it, and I really decided that maybe this was a good thing to do for a number of reasons, which I won't go into right now. But I started seeing patients with Salvestrols, using Salvestrols, about late 2012, 2013. So this is the book, and I have it in my hand. The Cancer Control Society received a bunch of them, and they are for sale at a discounted price at the Cancer Control Society book table. In this book, Brian Schafer discusses the history of Sip1 B1 and Salvestrol. He gives a bunch of case histories. He talks about how to maximize the effects of Salvestrols, and he tells his story about he had a number of patients, a number of family members who developed cancer, and he just was fascinated by this. He got involved with them, and he became a distributor for Salvestrols out of Canada. And so the ones that we carry in our office we get from him. And he also has a number of presentations, and he let me freely borrow from some of his slides. So some of the slides that you see will be from him. This is the most important thing that you need to know about the next 2-3 slides. The most important things you need to know about Sip1 B1 and Salvestrols. The protein enzyme Sip1 B1 is present in all cancer cells and some precancer cells, but no normal cells. That is key. Sip1 B1 is considered a universal cancer marker by some researchers. For example, in famous places like Dana-Farber in 2008 had it in a paper, and they also included it on their website in 2008, but they don't have it on their website now. There was research done at the MD Anderson, another famous cancer center, which showed that glioblastoma or brain cancer cells do have Sip1 B1, but normal brain cells do not. Now, this concept that there's a difference between Sip1B1 in normal cells and cancer cells is not found on the NIH or NCI website. You will see a lot of information about Sip1B1, but one thing you will not see is that there is a differential effect in terms of being present in cancer cells and not in normal cells. So this is, I think, one of the reasons, and we'll talk about a little bit about that and why there's confusion about that, but one of the reasons that there's been really no interest in the United States, hardly any no conventional doctors as far as I know, and very, very few alternative practitioners know anything about Salvestrols and its possible use in cancer. The few studies that acknowledge its existence in cancer cells actually target Sip1B1 as a target to try to destroy it in order to treat cancer. And as you will, hopefully you will see by the end of this lecture, that's exactly the wrong thing you want to do, because the Sip1B1 plays a role in helping the body to fight cancer. So now, that's Sip1B1. Now what about Salvestrols? Salvestrols are a group of relatively inert substances found in organic plants, and that would include fruits and vegetables and herbs. And they need to be organic. If they're not organic, they'll have very little Salvestrols. Salvestrols are converted by the Sip1B1 enzyme to metabolites that induce programmed cell death or apoptosis in cancer cells. And most people, who, of course, most of us don't, maybe in this room there are some that do, but most of us do not eat organic foods almost entirely, and most of us suffer from severe deficiency of Salvestrols, which predisposes you to cancer. And again, Salvestrols have no effect on normal cells, which do not have the Sip1B1. So we want to correct the Salvestrol deficiencies by eating organic fruits, vegetables high in Salvestrols. A person will convert the Salvestrols to metabolites which are capable of inducing apoptosis, which I've already said, in cells, cancer cells that are lurking in the body. So it becomes a kind of ideal type of cancer preventive. I just got an email the day before I got up here about from New Zealand, someone who uses Salvestrols a lot, and he told me about a cancer patient, a person who was diagnosed with colon cancer, and he was scheduled for surgery 4 weeks later. He started Salvestrols, and at the time they did the surgery, they could find no cancer. So it is an example of possibly how valuable this can be as a preventive and not just as a treatment. Now, for the Salvestrols to work properly, you need to not have inhibitors of Sip1B1. They need to be avoided. I've already told you about Laetrile, and I'll tell you about some more of them. Salvestrol deficiency can be corrected with a diet rich in Salvestrols or with a Salvestrol supplement, and we'll talk a little bit more about that. So the Sip1B1 Salvestrol, bottom line here, Sip1B1 Salvestrol system may be one of nature's main rescue mechanisms to prevent cancer from occurring and to help to deal with it if it does occur. So how does it work? I'm going to show you here. You see, okay. So this is a normal cell right here. And you see the normal cell, and this is your Salvestrol right here. So the Salvestrol goes into the normal cell, and nothing happens to it. No harm comes to the normal cell. However, if the Salvestrol goes to a cancer cell where Sip1B1 is present, the Salvestrol becomes activated and forms a metabolite similar to the Salvestrol, but not exactly. It has to be activated, and that's capable of inducing cell death in the cancer cells. Now, just recently, within the last 2 weeks, this is Dan Burke, who is a famous molecular biologist, and he did a module on Salvestrols, and if you ever get a chance to watch it, it's absolutely brilliant. I thank him for allowing me to use some of the slides that I think are just absolutely clever and important in this presentation, so you will get to see them as we go along. So just to tell you a little bit about Dan Burke, his background, he is the one that discovered that Sip1B1 was high in cancer cells but not in normal cells. It started with a sarcoma patient in the early 90s, and he found present in the cancer cells but not in normal cells. Then he did it the next year with the breast cancer patient, and over the next few years, he and his colleagues found 26 different cancers, and all of them seemed to have Sip1B1 in the cancer cells but not in the surrounding normal cells. He is the author of 200 published research studies. He is a special expert in the cytochrome P450 enzyme system. This is involved in phase 1 detoxification in the liver, and he is extremely expert, an expert in the whole cytochrome P450. He also developed an assay called EROD, which is used to monitor environmental pollution, very much in the conventional field. In other words, he's not an alternative practitioner or alternative scientist. Now, this is a very important slide. This is a slide of prostate cancer cells. Now, these are many different prostate cancers, and each of these rings have it. And the normal cells you see are surrounding normal prostate cells. And in the cancer cell cytoplasm, you see this brown substance. This is a dye that is there to dye the cytochrome P, the Sip1 B1 enzyme. And the cancer cell nucleus you see here is blue. But the brown is the Sip1 B1 in the cancer cells. And notice there's no brown in the normal cells around the cancer cells. So he points out here the biochemically stained blue. This is one of Dr. Burke's slides, is stained for blue and brown for the Sip1 B1. And there you see it. And the Sip1 B1 shows no, the nucleus shows nothing. In other words, the cytochrome P450, the Sip1 B1 is in the cytoplasm of the cell, not the nucleus. Now, this is another example of this. This was a study that was published back in 1997, and they looked at the cancer cells and normal cells and the concentration of Sip1 B1. And you'll see here in the normal cells, many different normal cells and normal tissues, and then the cancer cells in the accompanying tissue. Bladder, brain, breast, colon, connective tissue, esophagus, kidney, liver, lung, lymph node, ovaries, skin, small intestine, stomach, testes, and uterus. So these are a whole bunch of them. And you'll notice that in the normal, zero, none of the cells tested positive for Sip1 B1, whereas in the cancer cells, 122 out of 127, or 96%, tested positive for the Sip1 B1. So there are 30-odd peer-reviewed journals published since 1977, 3,300 samples, including 2,500 cancers of many types, showing overexpression of Sip1 B1 in many different cancers. And this was the quote that I said from Dana-Farber, that it's overexpressed in all human primary tumors, and that was a publication in 2008. And it's coming out now. This is a publication of 2015. Sip1 B1 are overexpressed in a wide variety of cancers. The results, Sip1 B1 was overexpressed in the samples from primary and metastatic loci of epithelial ovarian cancers. Its expression levels were significantly higher than in benign ovarian or normal tumors of the ovary. Now, why is this not mentioned on the NCI website, and why is there some issues? There have been people who have said, you're all wet on this Salvestrols theories because Sip1 B1 occurs not only in cancer cells but normal cells, so your theory is all crazy. And the question is why? Because there is literature that says that. And the reason is very simple. There are three aspects of the Sip1 B1. First, there is the gene. The gene is found in every single cell in the body. Okay? The second is something called messenger RNA, which helps to take the signal from the nucleus, from the gene, the Sip1 B1 gene. The messenger RNA goes to the ribosome in the cytoplasm of the cell, and that then stimulates the production of the Sip1 B1 enzyme. So the messenger Sip1 B1 is found in both cancer cells and in some non-cancer cells. The Sip1 B1 enzyme is found almost exclusively in cancer cells or precancerous cells. So the confusion in the medical literature is that they have not distinguished between the messenger RNA and the enzyme. So when they come up with the conclusion that the Sip1 B1 occurs in normal cells, but it does not. It's only the messenger RNA, not the enzyme. These are the inhibitors. I mentioned amygdalin already. You can't use these with Salvestrols, because what will happen is it will inhibit the Sip1 B1. You're not going to get any toxic effect, but it just won't work. Resveratrol in high doses. Interestingly, resveratrol was the first salvestrol that was ever discovered, and they found in low doses it inhibited cancer cells. But when they increased the doses, the effect went away and stopped. And the reason they found out subsequently is because the resveratrol in higher doses inhibits the Sip1 B1 enzyme, so it turns off the effect. The citrus flavonone naringin, which is present in grapefruit, some of you are aware, for example, you're told when you're on certain drugs not to take grapefruit juice because it may inhibit the breakdown of the drug. Well, the same thing is true here for this Sip1 B1. It will tend to inhibit it. Carbon monoxide is a big inhibitor. This is present in cigarette smoke. So to some extent, if someone's continuing to smoke and using Salvestrols, they're probably wasting their money, because it will not work in someone who continues to smoke. Now, the other thing here, which is really important, especially in our current culture, is various herbicides and pesticides, such as Roundup, as well as many household chemicals, drastically inhibit the Sip1 B1. And this is one of the reasons we want people on organic foods, and we want them to stay away, among many. There are many other reasons why Roundup and herbicides and pesticides are not good, and this is one of them. Now, interestingly enough, cannabis or marijuana, which is being used in a lot of anti-cancer work, there are 3 components they've established so far also inhibit the Sip1 B1. So I've generally discouraged my patients, although a few of them are doing it anyway, but discourage them if they're on Salvestrols to use medical marijuana or the marijuana or cannabis derivatives. Also, some St. John's wort and some aspects of ginkgo biloba and ginseng, things that are often used, I think, with cancer patients, may inhibit the Sip1 B1. So it's important, and you need to avoid the Sip1 B1 inhibitors. There are well-documented observations that Sip1 B1 is present in cancer. So the question is, how were Salvestrols discovered? I've already told you that Sip1 B1 is present in cancer cells. So the question is, why is it there? But not in normal cells, and not in normal cells. A team of scientists working together, namely Dan Burke, Gerald Potter, PhD, and Anthony Daniels, began to answer this question. There's a picture of Burke and Potter. Potter finds that many natural substances found only in organically grown fruits and vegetables, when added to cancer cells, suppress their growth. He called them Salvestrols, a derivative of the Latin word salvia, to save. 20 have been found. About 50 are expected to be found. So there are many Salvestrols. They're not in the same chemical family. They're not all the same thing. There are different Salvestrols. And they begin to determine their potency in killing cancer cells. Now, they teamed up with a guy named Anthony Daniels, who's a very brilliant mechanical engineer, who showed, and also an herbalist, and he showed that only the organic produce, and particularly the heritage non-hybridized varieties, produce high quantities of Salvestrols. And Salvestrols are part of the plant's defense against fungus, phytoalexins. And this is the reason that they have to be organic, because if you're using herbicides and pesticides, then the plants don't need to have these defensive actions to protect themselves, so they're not going to develop the Salvestrols. And Daniels also was excellent in helping them formulate the supplement Salvestrols. And the company was established, I'm not sure exactly what year, but I think in the late 1990s, called Nature's Defense. And they decided to use fruit in their Salvestrol supplement rather than herbs, because it was less controversial in terms of getting it through the regulatory agencies. It's just a plant extract. Now, they determined the relative effectiveness of cancer cells on normal cells. So, for example, they found that in methotrexate, for every cancer cell you kill a normal cell. And this S40 kills 10 cancer cells for each normal cell. And this other one, then they have 22, 32, 1250. This stilserine is actually a synthetic Sylvestrol, which is in the process of going through the regulatory process, and maybe we'll see it 10 or 15 years from now on the market, maybe. But this natural substance, S55, is 23,000 times. In other words, 23,000 cancer cells are dead for every one. So if you take phytonutrients found in fruit and vegetables, you add the enzyme, Sip1 B1 present, and you get apoptosis or cell death. So the Salvestrol uses a point system, and based on the selectivity of cancer versus normal cells, an excellent organic food diet contains about 300 points of Salvestrols. Each Salvestrol Platinum capsule contains 2,000 points. There are 4 extracts, 2 from citrus, 2 from bilberry, and that to be taken with or after meals. 2 of the Salvestrols in the capsules have selectivity scores greater than 20,000. Also, there's a topical cream that's available with just 1 Salvestrol in it. The approximate doses for prevention, about 1 capsule or 2,000 points a day, moderate deficiency, 4,000 to 8,000, severe deficiency, between 6 and 12 capsules, or 12,000 to 20,000. If a patient's had cancer and there's no evidence of it now and they wanted help to prevent a recurrence, it'd be about 2 capsules daily, 4,000 points. These are supplements which are known to increase either Sip1 B1 or help to convert Salvestrols to the metabolite. You need iron. It says cytochrome P450. Every one of these enzymes have iron as its core. It has a heme molecule, just like hemoglobin. So if you have an iron deficiency, we use this by checking ferritin, you want to correct that when you're giving Salvestrols. Magnesium is important, and I give some of the doses, niacin or niacinamide, biotin, selenium, vitamin C, and oxygen is absolutely crucial for Salvestrol Sip1 B1 activity, and there needs to be more research on possibly combining this with some of the methods of using of hyperbaric or ozone therapy or the oxygen bath therapy in Budapest that's being used currently. So what is the evidence that Salvestrol works in people? Well, there are no clinical trials or controlled studies, but there are reported and documented case histories. There are case studies reported in 3 journal articles in the Journal of Orthomolecular Medicine, which is not really indexed at this point for a variety of political reasons. But anyway, there are the cases. There are intriguing case histories reported by patients on Salvestrol on blogs on the internet, which you can check out for yourselves. And there are informal case studies, and I'm going to talk about that a little more than I have in previous lectures I've given on this, about developers of Salvestrol in New Zealand. And there are new reports from China and a few of my own preliminary cases I'll talk about today, because I've really only been doing this for a little over 2 years, so I don't have real long-term studies. But anyway, these are the case studies, and again, you get the actual references and so on from the handout I have, but these are available, and you'll see it's all different kinds of cancers: lung, melanoma, prostate, breast, bladder, liver, colon, Hodgkin's, squamous cell carcinoma of the anus, chronic lymphocytic leukemia, peritoneal cancer, and so on. So now this is another book published by Brian Schachter. As I mentioned, the first one here is available at a discounted price at the Cancer Control booth. This book, he picked up on the cases, and he did follow-ups on the cases that were published in the 3 journal articles, and describes and makes tables and talks about the relative different kinds of responders, and he also discusses diagnostic tests that are being developed for cancer utilizing the Sip1 B1 and metabolites of Salvestrols. Now, this is a very important point that I really want to hammer home. There are 3 types of responses to Salvestrols. They are the ultra responder, who responds quickly and completely, and I've discussed at least 1 or 2 of these cases. There's a typical responder that may take months to respond, and there appears to be non-responders. Doesn't seem to respond at all. It may be Sip1 B1 inhibitors are one reason, but there are probably other reasons too. I suspect maybe genetic mutations may be involved in that, but a lot of this is not known, and it is also not known what the relative percentages are for each of these categories. I suspect there are a lot more responders than non-responders, but I think there aren't some non-responders. Now, here are some 5 case histories that I'm going to discuss with you. One is, 2 of them are from Brian Schafer's paper from 2007. 3 are from our own cases personally. And one of the main points that I would like to make, and I'm sure this is true for many of you in the room, we should not depend solely on clinical trials for clinical decisions and actions with our patients, or for yourself for making your own decisions, because for the way the whole system is set up now, it's just designed only to use patentable substances. The substances that we talk about natural are not patentable, and they're not going to be huge studies. I don't know if some of you are aware of this, but in order to make according to a Forbes article in 2012, in order to get a drug approved by the FDA now, it costs $4 billion, that's with a B, dollars. The pharmaceutical company says $1 billion, but this article said there's actually evidence for $4 billion. the supplement companies don't have this kind of money. You can only do this if you're charging $20,000, $30,000 a month, for a treatment, and supplement companies are not going to get away with doing that. It's not going to happen. So the other thing is that Salvestrols seem to not interfere with conventional treatment, and I have many people who are doing both, and in some cases they may enhance it. So here's the first case. This is a rather remarkable case that's described in Schafer's book. It's a 93-year-old woman who couldn't walk. Workup revealed a malignant melanoma in one leg, numerous black spots on the skin indicating widespread metastases. She was told to make herself, family was told to make her comfortable, that there was no conventional treatment would help. The family decided, contrary to the medical advice, to start her on Salvestrol, about 3,000 points daily. She was also followed by a naturopath and given a number of other supplements. Within a few months, the patient began to walk, and the black spots on her skin began to fade. At the end of the year, she was walking with no more black spots. It's truly amazing. As far as I am aware, at least at this point, I don't think there are any kind of cases like this described with malignant melanoma. She died a year or two later, supposedly of a result of complications for medical treatment that was given for her Alzheimer's disease. Now, interestingly, I have a similar case. I didn't count this as one of the cases I'm discussing, but a man in his 70s with a malignant melanoma of his leg with documented metastases to his groin. And he's been coming to us now for 20 years. I don't do ozone therapy in my office, but I've been working with a colleague, Stu Friedenfeld, Stockton, New Jersey, who does it. And he's been using ozone therapy, and we've been using the high-dose Salvestrols and a number of other supplements. It's a complicated program, and I won't try to repeat that right now. He's getting vitamin C drips. He's getting the ozone treatment. And his black leg has completely become normal in color at this point, and he's made amazing and feels so much better. He's really doing very well. So that's a second melanoma case. Here's a patient also described in Brian Schafer's book. This is 69. This is also really very interesting. Tells us a lot of different things. Teaches us a lot of lessons. 69-year-old male in Canada began to cough up blood. Squamous cell carcinoma of the lung, 7 centimeters, and it adhered to the chest wall. At least 3 lymph nodes were involved, and tumor was deemed inoperable. No chemotherapy or radiation was recommended, and the life expectancy was 8 to 18 months. He started a diet of organic fruits, vegetables, juices. He cut out meat, refined sugar, and dairy were eliminated. And this was a program recommended by his stepson, and he started 4,200 units of Salvestrol spread out throughout the day. And within 1 week, the coughing of blood stopped. Within 3 weeks, the diagnosis was changed from an inoperable to an operable lung cancer, with the suggestion that the affected lung be removed. Within 3 weeks, a biopsy of the largest affected lymph node, according to the PET scan, was negative for cancer. The surgical treatment now recommended was, instead of removing a whole lung, to just remove a lobe of the lung. And then 6 weeks after that, after beginning the Salvestrols, so this is a rapid responder, surgery was performed. Instead of removing a lobe of the lung, only the shrunken tumor was removed. All lymph nodes removed were negative. The patient was deemed cancer-free. Salvestrol dosage was reduced from 2,000 points daily and stopped when he ran out. Also returned to previous lifestyle. Subsequently, believe it or not, the patient remained in remission for 5 years. In the spring of 2012, he was diagnosed with a recurrent squamous cell carcinoma of the lung. The stepson, who had originally guided him in this program, had moved away from the area, and instead of restarting the Salvestrols, he decided to just do conventional therapy, and we don't know his current status, but he went back to his previous lifestyle. And one of the most important things here I would recommend is, when you're on these things, it's not just a question of getting on a program for a period of a couple of weeks or a couple of months or even a couple of years, and then you go back to the old thing that got the cancer started in the first place. When you make these changes, if you want to live a long time, you have to stay with a lot of them. You may be able to cut down on some things, but you really need to stay with the lifestyle changes, and probably once you're on Sylvester, you should be at least on a maintenance dose of 1 or 2 capsules a day, and be ready to increase the dose if you've got problems. Now, this is a case, one of our cases, which is very fascinating. This is a 62-year-old woman who was married. She was diagnosed in November 2007 at our center with a marginal B-cell lymphoma. And she came to us. She had been started in 2005 and treated with the usual conventional Rituxan and CHOP chemotherapy, and it cleared up. But then she had very severe adverse reactions, and it started to come back. And she did not want to go back on chemotherapy. So she came to us in 2007, and we started her with C-drips, Laetrile, and many other strategies, and she did great for 5 years, with this marginal cell lymphoma. But in 2012,